I really want to break this down. I feel like this is like bullying in general. It's something that we all see, something that's like very subtle sometimes. And I really want to like almost like cut and dry identify like what bullying can look like. Like we talked about a little bit before how, in your situation, bullying was everybody wanted to be the best, like they were building, amazing nurses, but in the process we're like trying to break them down. Like in your experience, what does bullying in the workplace look like for people that have tolerated it for so long that might not even recognize what it might look like?
I think the most that we see this all the time in the operating room is like the subtle jabs to people, or like the trying to gang up on people, and the talking about people behind their backs. And I'm just like, I'm so sick of it. Like when I say I'm so sick of it, the second I hear you, and like the good thing about where I've worked most of the places, like the surgeons aren't that into that. No one wants to sit there and be catty. It's embarrassing and unprofessional. And I wouldn't even call it high school level. I would call it middle school level. But like, that is what I see the most, the gossiping and the laughing and and the trying to turn people on each other. Yeah. And even just recently, someone said in the surgery, like to the surgeon, I don't even think they thought I was listening. So-and-so is so exhausting. And I was like, excuse me? I was like, why would you say that? Like, you guys are wicked good friends. You know what I mean? Like, why would you say that? And I'm like, it's not right. And I just was like, I don't know. I just kind of hit a point in my life where I just had that epiphany where I was like, no one's going to do it around me. And like, there's a difference between talking about someone and venting about a situation. And I feel like that there's a fine line. Yeah. Like I'm here for, like I even had a coordinator recently vent to me about something and then come up to me later and be like, I don't want you to think I was complaining. And this and that. I'm like, you and I are friends, and I know you were not complaining, and I know you're not a complainer. And sometimes it just feels really good to vent to someone. And like, that's what was going on in that situation where they're bouncing ideas off me and I'm playing devil's advocate. Yeah. As opposed to Maggie was flirting with so-and-so. I hear that all the time. And I'm like, Maggie talks the same way to the doctor as she does to me. You know what I mean? Yeah. Sorry, I'm so passionate about it, but
I think that when people do make those subtle jabs, there's always an underlying, like, why? Like, is it because one situation is making you uncomfortable? Like, is it you're concerned about the patient? Like I think that it's important to try and get underneath, like, why,
I just think there's more professional ways of going about it. Yeah. Looking at someone you trust in private and not making those jabs at people publicly or whatever. Yeah. I think where we are going to have a little bit of problems with the newer generation is like when we use things as an example, because like that's how we learn. Is we use situations as an example, but I don't want the newer generation to think that we're picking on them, so to say. Yeah. You know what I mean? Like a situation where we don't want it to repeat itself in the OR or with equipment or something that's gone wrong. And that can be super stressful. Yeah. And even as a nurse of like 15 years, they're using me as examples in morning meetings often.
Nobody wants to be called out. It can feel like you're being attacked.
And I think that's one of the most, and just blatantly being rude, but like also having like the self-righteousness to know that, are they attacking you or is it the situation that is stressful? Yes. With the surgeons. Like, I mean, some people will be like, whoa, so-and-so yelled at you. And I'll be like, I didn't even notice because we were just doing our jobs and it was like you know what I'm saying? Yeah. I know that's so hard to wrap your brain around because I say it like that. I'm like, so-and-so yelled at me, but it's just, you just have to know, like when they're yelling in the moment about a situation that's unsafe and then taking that personal and just being like apologizing and moving on and fixing it. Yeah. Well, and I think closing the loop on that communication too, if there's any gray area for how you feel about something, like, let's say in a code situation, if somebody yells at me, and I'm still feeling some way about it, like at the end of the code, I could always close that loop and be like, hey, this, maybe explain my situation a little bit. And, it's going to be diffused, whatever
the thing was, because the heat of the moment is over. But like, just so I'm not dwelling on it, you know, for days afterwards thinking about it, or I don't want it to bleed into another interaction with the same person, you know, just being confident to, you know, normalizing that, like, hey, I didn't appreciate the way that, you know, you talked to me.
Or not even, I didn't appreciate the way you talked to me. Just be like, I understand that you were stressed out, but, you know, I communicate a little better if, you know, you wouldn't talk to me in that fashion.
Yeah.